Okay, good afternoon. I'm Janelle Heinrich. I'm the Director of Public Health, Madison and Dane County. It's been quite some time since the mayor, the county executive, and I have come together to provide you with an update about the status of COVID in Dane County. As we see cases rising in our communities and across Wisconsin, we felt this would be a good opportunity for a touch point to check in with regarding where we're at in our community. It's true. The number of new cases of COVID-19 has tripled over the past month in Dane County to an average of 379 per day. Of course, we do not like to see this level of infection. And while this is a moment to pay attention and to be aware and to evaluate our risk, I want to emphasize that this is not a time for panic. Cases alone are no longer our primary cause for concern. While hospitalizations have been increasing lately, they are still far lower than during previous COVID surges. This is likely due to a variety of factors, including protection from vaccine or from previous infection or a combination of the two, and new medications and treatments to keep people from having severe outcomes. As of today, Dane County is currently experiencing COVID activity on the higher end of the medium category, according to the CDC's community levels. This risk is determined by looking at total new COVID cases and hospital admissions, along with that number of hospital beds filled by COVID patients. If we do tip into the high category, our advice would largely remain the same. Get vaccinated and get boosted and get tested if you're feeling unwell. But at that point, we would also strongly recommend that everyone wear a mask in indoor public spaces and crowded outdoor spaces. As your public health department, we are continuing to pay careful attention to the ebbs and flows of this virus and the new research and the new science that continues to evolve. We are continuing to assure that there is ready and accessible access to testing, to vaccines, and to information to keep you well. It's our mission to provide support to our community in staying healthy, and we're urging you to lean on that support now. Thank you. And with that, I'd like to turn it over to the county executive.
Thank you, Janelle. Good afternoon, everyone. Well, we were trying to find a way to bring rising COVID rates to people's attention, and COVID found me. So I can vouch for the fact that COVID is back. For myself, fortunately, so far for the last couple of days, I've just had mild symptoms. I'm vaxxed and boosted, so hopefully that will remain the same. To everyone who's been sending me well wishes, thank you very much. I appreciate it. But we do want to make sure today that everyone is aware that COVID is still here, cases are rising, and it's a good idea to know your risks so you can take appropriate precautions. If you're older or have pre-existing medical conditions that put you at a higher risk for more serious illness, it's a good idea to practice what we know works. We know that outdoor activity, as well as open windows and good ventilation while indoors, are all good ideas. And if you're going to be in a crowded indoor space, you might want to mask up. This, of course, is all on top of getting vaxxed and boosted. Our community has one of the lowest per capita COVID death rates in the nation because you've all buckled down and taken appropriate precautions over the past couple of years, and we thank you for that. And while we had hoped COVID would largely be behind us now, our new reality is likely to involve adjusting our behavior as virus levels fluctuate. Not fun, but a fact of life, at least for now. So thank you for coming together as a community to do what needs to be done to protect yourselves and your neighbors. We'll keep you posted on the latest data and work to get you the information you need in order to make informed decisions and keep you and your loved ones safe. Thanks very much. I will turn it over to the mayor.
Thank you, County Executive, and let me add my well wishes to everyone else's. I hope that you
Thanks.
don't get sick very much and that you feel better very quickly.
I appreciate it.
I do just want to emphasize how important it is for us to use the tools that we know work to protect ourselves. And one of the most effective and best ways to do that is to stay up to date on our vaccination. It's really the best way to ensure our protection against getting seriously ill due to COVID. It's also the best way to ensure that our healthcare systems don't get overwhelmed by an influx of patients. As of March of this year, 2022, a person not fully vaccinated was 1.2 times more likely to test positive and 4 times more likely to be hospitalized than someone who was boosted. So personally, I've gone out and gotten my latest booster because I'm eligible. And so I'm fully up to date on my vaccination. And I hope that all of you are as well. And that anybody who's eligible for another booster at this point will go and take advantage of that. Um, little bit of breaking good news is that the CDC now is recommending boosters for 5 to 11-year-olds. There's a few more steps that have to happen before those will be available locally. But to me, that's great news that even more people are going to be eligible for boosting. And we certainly hope that everybody who's eligible will go and get that booster. I also want to really thank everybody here in Madison and Dane County who has risen to the occasion over the past years and has gotten vaccinated. It Every dose makes a difference and contributes to our collective immunity. So thank you to everyone who has rolled up their sleeve and gotten that shot. It's actually pretty impressive numbers countywide. We've had over 460,000 people who've received at least one dose of the vaccine, and over 436,000 people who have completed the initial series. Those are great numbers. But there's about 20% of folks who had the first series of vaccination that have not yet received their booster dose. So it's really crucial that you follow through and get boosted if you're able to. If you've been putting it off, now is a great time. And it's really easy to make an appointment. And we've got the resources through public health and their clinics, and they're out in the community making vaccination available. But you can also just call up your local pharmacy or hop online and make an appointment. There's a lot of ways that you can go and get boosted, very easy and very accessible and free. So no reason to hesitate. It's a great time to do that today, even. There's no question going forward that COVID is and is going to continue to be a part of our lives. And as the county executive said, what that impact will look like on our day to day is going to change as we see variants come and go and cases rise and fall. But the difference between when this pandemic started and what we're experiencing now is that we know the best tools to keep ourselves safe. We know that we can keep ourselves up to date on vaccination. We know that if we're not feeling well, we need to stay home and get tested. We know that wearing a mask indoors or in crowds, especially for anybody who's higher risk, is an excellent tool to keep ourselves safe. And we know that people who control buildings, business owners, institutions, can help mitigate the spread of COVID by improving ventilation, supporting employees with paid sick time, and supporting reducing crowding in indoor spaces. So every one of us has something that we can do to help. And I really encourage everybody to, continue to take the situation seriously and do what you can to reduce the spread of illness in our community and to keep yourself safe. And thank you again for everybody who is doing what you can. And I think now we'd be happy to take questions for any of the three of us. If you want to go ahead and use the raise hand function, I'll call on you. We'll start with Bridgit Bowden.
Hi, yes, thank you so much for having this call. I'm wondering, so you said that if we were to tip into that high range, you would be strongly recommending masks indoors. Could you explain how that would differ from a mandate and why not have a mandate?
Sure. I mean, we would communicate robustly, loudly, and widely about the value of wearing masks and the difference between where we are now and why we would, maybe put out an advisory versus an order is because, as the mayor has articulated and we've all, said, we are in a very, very different place than we were. We have tools available to us to prevent more illness that we did not have at the beginning of the pandemic. And we are not quite in the same place with our surges as we were earlier as well. So those are considerations and factors that we would put into consideration to make that decision.
Thanks, Bridgit. Our next question is from Rhonda Foxx.
All right, so I have two questions. The first question is for Janelle. The second question is for County Executive Parisi. The first question is, according to the Wisconsin DHS, 25% of 5 to 11-year-olds have completed the vaccine series, and that seems a little bit low. With waning immunity, are you worried about a summer surge of COVID in this age group? That's for Janelle. And the next question would be, amid the rising COVID cases in Dane County, Executive Parisi, you would like to extend the emergency shelter program for those experiencing homelessness. And if you could talk a little bit about why.
So, we have about 60% of our 5 to 11-year-olds have received at least one dose of vaccine here in Dane County, which means there's more that are still eligible for their second. And so excited that we have folks hopefully soon who will be eligible for their booster. I'm always concerned that we may see more virus in our littles and ask our parents to do, and people who care for children, to do everything possible to keep our kiddos healthy, safe, and well. And so if you're eligible for vaccine, please get that. And I think we are not yet for certain of where the seasonality of this comes in, and more around what happens in the seasonality of waning immunity versus, is it summer, is it being connected together, and how do we just lean into what we know works to prevent the risk. And that's my ask, and that's staying up to date and making considerations about how we may be in community with each other and the ways that we do that, knowing that we can layer in other preventive strategies to reduce that risk of illness.
Thanks, Janelle. Regarding the hotels, yeah, so, I personally was unfortunate because I tested positive for COVID, but I'm also very fortunate because I have a home. I have a safe place to lay my head at night while I'm recovering from COVID. And there are vulnerable people in our community who don't have that. And when we see the surge that we're seeing now and the increased risk to people, especially vulnerable populations, I think it's important that we do what we can to try to take care of those folks and provide them a safe place to help avoid being exposed, and if they are exposed, a safe place to be while they recover.
Thank you, County Executive. Are there other questions? If you have a question, please use the raise hand feature in Zoom and I'll call on you. Tim Stumm.
Hi. Hello.
Go ahead.
Hi, thanks for hosting this. Just wanted to follow up about the mask recommendation. You noted that if the county gets to the point where the CDC would determine it a high level for COVID-19, you'd strongly recommend masks. Do you anticipate that there could ever be a point again where you would require masks, or is that pretty much off the table at this point?
I think these are these crystal ball moments, right? I would like to say never, but we never know. And I think what we've learned through this pandemic is that there's been consistent evolution and unexpected moments. But right now, we are not in the place where we don't have those tools that we had in the past. We have tools that we did not have in the past. And so that makes it a different situation at the policy level, where we have things available to us and makes that requirement different than those strong recommendations.
Other questions? if not, then we'll say thank you all for joining us today, and just end with another reminder that we really would encourage people to go out and stay up to date on their vaccination and keep yourself safe. Thanks, everyone.
Thanks, everyone. Take care.